And Richard Epstein, you've called for competitive markets and deregulation as being a better way to go in terms of health care, but why would that be incompatible with the kind of system that Professor Herzlinger is describing? Couldn't the government in fact say, yes, you shall have competitive markets and you will have universal coverage through these competitive markets?
It turns out politically it's impossible. We've always tried this with respect to Medicare, and it becomes a command and control system with a heavy degree of cross-subsidy that's unsustainable if given to the general population. You cannot, in effect, subsidize, say, $7 out of $8 that people receive. And if you look at the political dynamic in this country, if you have to cut back on the money that these people are going to receive, they're going to resist the very programs that she wants. That's the first problem. The second problem is you have to understand that there's a little cook in what she has said. She says, we'll let them determine the kind of coverage they'll get, thick or thin. Well, now what happens is she's actually inconsistent with the secretary, because suppose somebody decides to buy thin coverage, and thin coverage doesn't cover a disease which causes a fatal condition. Under the Regina's world, what happens is you die. Under her world, you didn't buy the insurance, we give you the coverage anyhow. So that what happens is you buy thin and you end up thick whether you like it or not. The last point I would make is that you're trying to get from here to there. I think I could run a relatively good cross-subsidy program in a state like Switzerland, small population, relatively homogeneous in wealth and so forth. You'd expand the scale by perhaps 50-fold. You increase the enormous regional disparities, educational disparities, and everything else, and you're trying to make the sums come out. It's not going to work. This is the simple proposition I would want you to live with, is we are much worse than Switzerland on the degree of regulation that we have in these voluntary markets. The simple and securest way to increase access today is to reduce the cost so that people could re-enter the market. We have driven people out of the market in droves, in millions, and then having regulated them out of the voluntary market, we assume that the same people who busted that up beyond all recognition can figure out how to make it coherent when they call the shots. And remember this point, if you're paying the money, you'll attach conditions to the way the money is spent, and the idea that you can have subsidies without government restraints is one of the great political pipe dreams of all time.